that we need to identify additional resources and put additional attention behind the second pillar, that of putting families first. We're pleased to be able to implement the Displaced Children and Orphans account, which assists programs to benefit children in vulnerable households, and especially outside of family care in some 45 countries. These programs promote family-based alternatives to institutional care, something I care deeply about as the adoptive parent of two absolutely fabulous children. These programs also prevent family separation. They facilitate deinstitutionalization. They strengthen the capacity of families and communities and governments to care for children. We've succeeded under these programs in moving literally thousands of children from institutional or orphanage settings into appropriate and protective families. I will indeed. It's equally important that we protect the world's children from violence and abuse, especially in situations when social order breaks down or in situations of natural disaster. Last year, we promoted some 24 humanitarian assistance programs to address child protection for vulnerable children. We also are supporting the minimum standards for child protection in humanitarian action. And we've put together new policies and programs to fight the phenomenon of child marriage, child soldiers, and child labor exploitation. These challenges are daunting for us, and we're not satisfied with the results we've achieved. Dr. Boothby will describe for you our efforts to restructure and reinforce our work to create coherent and visible homes for children in adversity, our efforts to build better cooperation among agencies, and our efforts to strengthen oversight to ensure effective implementation of the action plan. We must come together as a whole of society to bring strong beginnings, put families first, and protect our children from violence and abuse. The next generation of world citizens deserves nothing less. Thank you so much, Dr. Steinberg. Dr. Ryan?
Chairman Leahy, Ranking Member Graham, Senator Landrieu, thank you for the opportunity to appear before you to discuss the U.S. President's emergency plan for AIDS relief and to highlight our essential work to support orphans and vulnerable children. On behalf of the entire PEPFAR family, we are profoundly grateful to Congress for its sustained investment in and support of our programs. In 2013, PEPFAR will celebrate 10 years of success. None of this would have been possible without the vision and leadership of President Bush, President Obama, and the bipartisan support of Congress. A decade ago, AIDS was wiping out an entire generation in Africa. Today, because of the efforts coordinated by Ambassador Eric Goosby at the Department of State and those of its many partners, we have brought the world to a new era, a time when new AIDS infections, HIV infections are on the decline, and AIDS deaths are also in decline, and an AIDS-free generation is both U.S. policy and a goal within our reach. As of October 2012, PEPFAR directly supported more than 5 million people on antiretroviral treatment. That is a threefold increase in only 4 years. This means that more parents with HIV are staying alive, thus averting 1.6 million children from becoming orphans in 2012 alone. PEPFAR also supports ARV treatment to prevent mother-to-child transmission to more than 750,000 pregnant women living with HIV, and directly supports 15 million people with care and support, which includes nearly 5 million OVCs. PEPFAR already supports and plays a critical role to contribute to the objectives of the recently released U.S. government's Action Plan for Children in Adversity. Our 2012 OVC guidelines outline our strategic goals. 1, strengthen families as primary caregivers of children. 2, support the capacity of communities to create protective and caring environments. 3, build capacity of social service systems to protect the most vulnerable. And 4, integrate OVC programs into the broader PEPFAR platform and response. The impact of HIV on AIDS on children is absolutely devastating. It's estimated that there are 16 million children that have lost one or both of their parents due to AIDS, and 90% of those live in sub-Saharan Africa. Children can quickly move from being affected by HIV to becoming infected with HIV, and an estimated 3.4 million children under the age of 15 are now living with HIV. PEPFAR's comprehensive, integrated, evidence-based approach has had a transformative effect. While it's well known that PEPFAR dedicates 10% of its country funding to orphans and vulnerable children programs, our OVC interventions gain from their integration across the broader PEPFAR platform. And family strengthening is a major priority for PEPFAR programs. We support family unity both through keeping families and caregivers healthy and alive to care for their children, and also through household economic strengthening. We also support parenting skills training, educational support, and early childhood interventions, such as preschools. For example, in Rwanda, the PEPFAR global community supports stability and resilience in the most vulnerable of families, those affected by HIV and AIDS and with OVCs. Since 2009, this program has served over 62,000 households, delivering a holistic package of services that are designed to build household resilience, including economic strengthening, food insecurity, nutrition, and formal educational assistance. PEPFAR also strengthens community and system responses to combat gender-based violence against children, including improved legislation and enforcement of child protection. Addressing all of these needs requires a strong child welfare system that facilitates access to services across sectors, including social protection through child grants, deinstitutionalization, foster care, local adoption procedures, and resources. PEPFAR has strengthened the capacity of partner countries to improve the leadership and governance of social service ministries, civil society organizations, faith-based organizations, and communities that support children. In South Africa, we have been supporting the Department of Social Welfare to hire 10,000 new children and youth care workers by 2017. These workers will protect children from exploitation and abuse, ensuring children remain in school, and referring for children for HIV testing. 36,000 children were referred for HIV testing in 2012 alone. Thank you again for the opportunity to testify before you, to share what PEPFAR is doing across the globe to bring children out of adversity and to create an AIDS-free generation. Congress's 10 years of bipartisan support and an investment in PEPFAR's work has profoundly improved the lives of so many children and their families. This has only been possible because of PEPFAR's integrated approach, which strengthens access to medical care, support services at the family, community, and country level. While significant challenges remain, there is no doubt that millions of men, women, and children have a brighter, healthier, and more productive future thanks to PEPFAR. This is truly a smart investment in our future. Thank you.
Thank you very much, Dr. Bissell.
Good morning. Good morning, Senator Landry. Thank you very much for inviting UNICEF to brief you here on the role that we play globally in the protection of children. And if I may, before I get into the full remarks, I wanted to express particular thanks for the leadership of Senator Leahy on a particular area that this subcommittee has worked on, which is protecting children from the effects of landmines and explosive remnants of war, particularly relevant in our contemporary child protection work. We have ample examples of UNICEF and American government collaboration in child protection, including in gender-based violence prevention, a pioneering public-private partnership we're involved in right now with USAID, PEPFAR, and the Center for Disease Control, where we are working on the prevention of violence against children and in particular sexual violence in girls. We also work together with the Displaced Children and Orphans Fund, strengthening child protection systems and strengthening families to enable them to stay together. And we also have our collective efforts with the US government on the prevention of female genital mutilation and cutting, as well as child marriage, which Dawn has already mentioned. Madam Chairman, a key principle in our child protection work is universality, and accordingly, we focus on children everywhere. We also realize that children do thrive best in loving and supporting families. An important principle in our work includes protecting all children in early, middle, and late childhood. We engage with specialists in early childhood education, at primary and secondary education, health, and importantly with experts in adolescence and youth, as well as gender. Prevention is the critical feature of all of our work. To wit, we do not want the 1 billion children living in countries affected by conflict to be its victims. And we're active in these countries that are affected by armed conflict, preventing the recruitment of children as soldiers and integrating them into schools and communities, as well as attempting to return them to their families. We're on the ground where children are displaced across borders and within countries, including where there are natural disasters. And we're slowly winning the fight together with partners against child labor. But the recent tragedies in Bangladesh and Cambodia are a stark reminder that not enough is being done. Preventing trafficking also preoccupies us and many of our partners. Madam Chairman, 220 million children under the age of 5 don't even have a birth certificate right now. A birth certificate is a basic form of protection of children. It also allows them access to health care, to education, and prevents them from being married early, recruited into labor. Technology, innovation, and political will are helping us to make sure that children are documented. Caste, class, faith, and ethnicity simply don't matter in this regard. We're using technology also for family tracing and reunification after floods and earthquakes. With an emphasis on prevention, we also know that we need to respond to those who experience violence, abuse, exploitation, and neglect. We have a child protection strategy that lays out some fundamental approaches, and there are two sort of pillars in that approach. The first is strengthening parts of what we would call a child protection system. You've referred to that already in your comments, Caroline. Social welfare, justice, labor, planning ministries, together with health and education, coming together to create an allied system that prevents violence, abuse, and exploitation, and social workers, a social worker workforce, such as we see a health workforce, is integral to the success of that system. But we know that even where we have strong child protection systems in place, there are aspects of social change and social norms that prevent, if we can put it that way, the protection of children. And to address social change and harmful social practices such as child marriage and female genital mutilation and cutting, we engage with local leaders, the faith-based community, and others to whom families and communities look for wisdom and guidance. Social change requires deep and sustained cooperation at local levels. Finally, our child protection efforts rely on good data. In times of conflict, and in particular in countries and parties that are listed by the Security Council for having grave violations against children, of which there are 14 at present, we're a key party to what's called the monitoring and reporting mechanism, wherein we are creating databases of the killing and maiming of children, sexual violence against children, recruitment and use by rebel groups as well as armed forces. Madam Chairman, what can be more important than the protection of our children? We protect them to enable them to develop, to grow, to become active and productive citizens in safe families, safe communities, and societies. All of this protection comes at a cost, but to coin the phrase of some contemporary thinkers, the cost of inaction is simply too high. Thank you for inviting UNICEF to be here and for including our views in this very important hearing.
Thank you very much. Dr. Boothby.
Thank you, Senator Landrieu, for your leadership and, more importantly, for your heart. You've already outlined essentially what the U.S. Action Plan on Children and Diversity is. It's the first ever whole of government strategic guidance for the U.S. government international assistance for children. It's a requirement of Public Law 10995. 7 U.S. agencies and departments have endorsed the action plan, which was cleared by OMB and launched at the White House on December 19th, 2012. The goal is simple: to achieve a world in which all children grow up within protective family care, free from deprivation, exploitation, and danger. And as you've already noted, it has 3 core objectives. One we're referring to as strong beginnings. Now, most of us are familiar with the 6.9 million preventable deaths and the incredible effort that is underway to reduce that number. What we may not be less well aware of is 200 million children will fail to reach their full potential, their full developmental potential. And the reason we have to ensure that child development stays on a healthy track is because we know much more now than we did before about the consequences of it being off track. Adverse early experiences, including unstable caregiving, deprivation of love or stimulation or nutrition, and stresses associated with neglect and maltreatment greatly increase the likelihood of poor health outcomes across the entire life course. The evidence is compelling to expand the child survival agenda to encompass child development as well. We have science that now tells us is imperative, and our programs need to catch up with that science. The family care first objective is extremely important. We are wired neurologically, if not otherwise, into relationships. It's actually in our DNA. And we have seen babies in Goma, for example, in the aftermath of the genocide in Rwanda, the summer of 1994. I was working there with a special envoy and watched babies die by the tens per day, sitting on cots like loaf of breads with IVs in their veins, being fed, being taken care of from a health and nutrition standpoint, and they were dying because they did not have that human interaction or contact. It's called failure to thrive. And we know from the Bucharest study, which Dr. Nelson has played an important part of, short of dying, children growing up in institutions can have IQs as low as 64, when the control group outside were up to 103, and if you don't get them out of that situation within the first 24 months, they never recover that intellectual capacity. So there's an urgent need to focus more firmly on this particular objective. And in my role as special advisor in Public Law 10995, I will say unequivocally that this is a gap area to what is otherwise a very generous and robust response to these sets of issues. Protecting children from violence, exploitation, abuse is the third sort of pathway out of adversity. These three pathways focus on brain health and body health, make sure kids stay in families, and protect them from violence are the three minimal investments and pathways out of adversity. This is what science would tell us. Between 133 million and 275 million children are estimated to witness domestic violence annually. 150 million girls and 73 million boys under the age of 18 experience forced sexual intercourse or other forms of sexual violence in 1 year. And the percentage that's happening in schools is obscene, and it needs to be addressed. What I'd like to do is spend my last 50 seconds here talking about implementation. We have agreed in the action plan to focus on focus countries or priority countries. We're meeting weekly now to determine what those countries are. I'm going to use Rwanda as an example, illustrative only. If we were to look at approximately $21 million that's being spent in Rwanda by the U.S. government in health and nutrition, and added a bit to that, we could transform that health platform into
Take your time. Go
strong
ahead. I want you to
beginnings.
explain this.
Okay. We could transform this already robust child survival, maternal health, reproductive health, nutrition platform into a strong beginnings initiative that would reduce by 40% developmental delays in 4 years. Modest investment. We are already funding, the government of Rwanda is committed to deinstitutionalization, to getting kids out of orphanages into families. USAID is providing $3.2 million towards that effort. It requires a bit more. With a bit more, we could reduce over 4 years the percentage of children living outside of family care by 75%. The third area, let me just augment the second area. PEPFAR is a leader in the area of preventing family separation. And Caroline has made reference to this. It is a game changer. It is a mega force out here that occupies this space in a way that no other government agency or other government does. And I want to just make that really clear. They focus on prevention for the most part. The part that's missing really is the deinstitutionalization and whatnot, and the resource base there is not adequate. Protecting children from violence is an imperative. Just to mention a couple of agencies, CDC is going to be engaged in Rwanda with the government to look at surveillance, to actually create a system where we can measure results. And our friends at the Department of Labor, DOL, are engaged in an initiative in Rwanda that will eliminate, and I love that word, eliminate exploitive child labor, eliminate children in the T sector industry within 4 years. When we work together, when we combine, when we look at synergies and working together, we can accomplish a lot more than we're currently doing separately. Thank you.
Thank you so much, Dr. Boothby. And I'm going to have a line of questioning because I think it's some of the most important testimony this committee will receive is the game-changing possibilities of getting other U.S. agencies involved in meeting the objectives so beautifully stated by other members that testified, but really impossible to do without a more unified and comprehensive and coordinated approach. So thank you very much. Let me start with Administrator Steinberg. On December 19th, 2012, the U.S. Action Plan for Children was launched at the White House, as you know. This effort represents the first time which appropriate and permanent family care has been explicitly set forth as a core objective of U.S. foreign assistance policy. Objective 1 of the plan calls for strong beginnings. I was pleased to see the maternal and child health account in this committee grow from $680 million, 12% up from 2012. However, Action Plans 2 and 3, which call for a family for every child with a particular focus on getting children out of institutions and into families, and protection for children. And again, to underscore, the best protection any child could have is not a government, not an army, not the Navy, not the Air Force, but in the loving arms of a supportive and nurturing family. What are we going to do, or how can the action plan present a coordinated approach if key accounts used for the collaboration for the second and third, the vulnerable children account fell from 13 million, 26% below FY 2000. And so how are we going to meet objectives 2 and 3 with $13 million? And if there is more, please testify to where it is in the USAID budget, what additional divisions and what other funds are specifically responsible for focusing on objectives 2 and 3.
Madam Chairman, indeed, the $13 million that Congress has appropriated to us for the DCOF program is an important element in addressing objectives 2 and 3, but it's only a tip of the iceberg. We have to expand our assistance under our global health initiatives. We effectively use at USAID much of the funding that Dr. Ryan was referring to. We implement a wide variety of funds under that initiative. We have also made resources available to Objective 2 and 3 in support of Dr. Boothby's efforts from the Administrator's Initiative Fund, which is a special fund that he has available to address.
And how much is that fund?
That fund is $5 million, and we are in the process of trying to determine exactly how much of that funding for next year we will provide in this space. And the information you're providing in this hearing is going to be very useful for that. In addition, however, we have a very important element in terms of mainstreaming and integration these principles into our broader programmings. And so as we look at our program for Feed the Future and for climate change and democracy and governance, we have done trainings for our staffs. I've participated in a half dozen of those trainings where we highlight the need for family orientation, we highlight the need to prevent violence against children, and we ensure that there is indeed mainstreaming in that area. The third area that we're working in is partnerships, and Dr. Boothby can describe these much more carefully, but we are working with non-governmental organizations, we're working with foundations, with private businesses, and with other donors to create international partnerships that can dramatically expand the funding that's available. We realize in the U.S. government that no agency has a monopoly on financial resources or ground truth or good ideas or moral authority. And I I'd like to leave it to Dr. Boothby, who has been the key in putting those partnerships together, to describe those.
Okay, I will call on him in a minute, but let me understand clearly for the record a couple of things. In your view, is it true that the Action Plan for Children in Adversity is the first time the U.S. government has set forth a whole-of-government, outcome-focused strategy to help better align our foreign assistance resources for vulnerable children in the world? Would you say yes or no?
Yes.
If so, could you state again succinctly and clearly how USAID is positioned to lead and oversee the level of interagency cooperation that is now necessary under this plan, and what resources do you have to do that?
Well, the first thing that we did was to set up Dr. Boothby in the office as a full-fledged center. So he now has a center of excellence. We have staffed that with a wide variety of individuals. We have identified within each of our other bureaus individuals who work with him to ensure that the multitude of USAID programs are indeed dedicated to the initiatives that he's identified. By June 20th, we have committed to put together the plan to implement for USAID the programs that we've been discussing, including the identification of 6 target countries. I myself have traveled around the world and talked with mission directors to encourage them to be the sponsors of this program in their countries. I would be the first to acknowledge that we have a long way to go. The program has only been in place for about a year, building on the great work that Gary Newton had previously done as the coordinator. But this indeed is the first time we've brought together the whole variety of U.S. government programs. We did in our report to you, 10995, identify the literally 1,500 projects that are being conducted by the U.S. government, and in particular by PEPFAR and USAID in support of the objectives you've identified.
And that's exciting to have 1,500 projects that we've identified, but to have $5 million to coordinate them is, I think, the gap that Dr. Boothby and others are concerned about. Let me ask you this question, Dr. Boothby, to follow up on what Administrator Steinberg said, and I want to commend you all for a close working relationship and really appreciate the team effort that you all are making here. As you are aware, because you run this, the Public Law 10995 passed in 2005. It required USAID specifically to establish a special advisor on orphans and vulnerable children, develop an interagency strategy for more comprehensive, coordinated, and effective response on behalf of U.S. government to the world's most vulnerable children, thinking about AIDS orphans, actually. Is it correct that the Action Plan for Children in Adversity grew out of a shared desire to improve upon the 2006 coordination strategy, which focused almost exclusively on programming for children affected by HIV, which did not include input from critical departments, which lacked some clarity regard to goals, objectives, and outcome indicators? Would you say that that's a fairly correct description of the first law and the need to upgrade it, or what would your views of that be?
Thank you. I think it is fair to say that since 2005, the world has evolved, and the U.S. government's response to these issues have evolved, and there's more actors and more parts in play. I think it is fair to say that the original strategy was very HIV/AIDS-centric and really encouraged, if I understand the history correctly, by our HIV/AIDS colleagues to expand out to include other issues. And so the U.S. Action Plan is an effort to put together a framework and to focus on 3 core objectives and to begin doing these 3 objectives in 5 or 6 priority countries over the course of 4 or 5 years. By focusing and moving towards effect, we can actually, the concept we're trying to prove is by doing this in countries and combining resources and co-locating resources that the mandate, the law, Public Law 10995, will actually be realized at the country level.
Thank you. Dr. Sternberg, let me ask you this, and then I'm going to move on to some other questions to other panelists. You've identified the resources, which are very slim. I think you said $5 million. Do you need additional authorities in order to accomplish what Dr. Boothby is saying, or is it really just a matter of resources and organization? How would you clarify or testify to this?
I would say it's primarily a question of resources. I think with the leadership that Dr. Boothby is providing, with the strong support of Administrator Shaw, with frankly my own personal engagement in trying to achieve these objectives, I think the will is there. I think the intellectual brain power is there. I think you and other senators have provided us, along with House members, the attention that we need. But indeed, I think this is a question, we're in a period of constrained resources, and we have some tough decisions to make.
Okay, let me ask Dr. Ryan, in 2012, 10% orphans and vulnerable children set aside in PEPFAR totaled $330 million, as you know. PEPFAR is, as Dr. Boothby said, and we all recognize, is the largest single investment made for health in the world, and we're very, very proud of what we've done there. But some of us had thought that setting aside 10% focused on orphans and vulnerable children, $330 million, might be a good start to help focus the need for single and double orphans to find families if their original family wasn't able to be kept alive. What percentage of the 10% set aside today is used to fund programs that are not health-related, that provide assistance specifically to orphans and children that find themselves without a family, having perished from the disease?
Thank you, Senator, for your question. It's a very important one. And I look forward to perhaps giving you more detail. But the majority of the programs that are under that 10% are not health-related, because the guidance to our countries is that any care for pediatric care, any drugs would not come out of that budget code. So it really is for social service support. We see it as sort of the community level support. It also is for things such as deinstitutionalization, like in PEPFAR, where the government asked us to train social workers so they could process placement and permanency, and also support community service organizations, FBOs, to identify adopting families and provide family follow-up. So we actually find we've been very careful about making sure that that did not become a pediatric AIDS resource, especially in the limited environment we all are in, and we fought very hard to keep that. It really is in our program a very strong part of our continuum of care and support to the community response.
Okay, I think it would be very helpful to this committee to have some real detail about the $330 million that's been approximately that amount in the budget over the last several years, about how many new families, both domestic and international, were found for double orphans, what the most likely outcome is for single orphans, et cetera, in some specificity, because I think this committee and I am having a little difficult time sorting through some of that data, because this could be a resource solution here. It's, $330 million is a lot more than $5 million. And while your program is specifically focused on children affected by AIDS, as Dr. Boothby said, before, and I've heard him and I've said it, I mean, this disease is one of the great produces orphans at a greater rate than almost anything in the world. And, so while it's not the only subset of orphans, it's a big, it's not the only subset, it's a big subset. It's probably the largest subset of orphans, perhaps. It's going to be interesting to get this data. But if you could submit that to the committee, and I'm glad to know that you recognize it as not just another health account, but as a specific response for those children orphaned by AIDS or likely to be orphaned by AIDS, to try to find them a permanent family.
We'd
That's
be happy to support.
very,
that.
very good to know. So how much would you say is focused on finding permanent family care for children? Would you say that 330 or a big percentage or half, or what would you say?
You know, I would prefer to give you a more detailed answer, so we will submit that to you.
Okay, that would be great. Let me ask again here, over the past decade, PEPFAR has worked hand in hand with partner countries to provide the physical, emotional, and social support that strengthens families and communities and mitigate negative outcomes for children, including robust efforts to prevent mother-to-child transmission of HIV and expand access to pediatric HIV treatment. To what extent do you see programs funded by the 10% set aside being aligned with the goals of 2 and 3? I think this is a repeat of a question, but basically, can we take away from this hearing that the 330 is really focused on goals 2 and 3 of the Children in Adversity Plan?
I would say that we are, that there is putting families first and protecting children against violence, since we have been supporting the majority of the violence against children programs and then working with partner countries to get a plan at the country level for a response. We do support the Strong Beginnings through early childhood development, and we have programs in Zimbabwe, Kenya, Malawi, South Africa that have led to the establishment of thousands of new preschool classes for young children. And what we're trying to do is also integrate attachment and stimulation into PMTCT and pediatric programs. So it's a very good venue. But I do agree that that is an emerging part of the program, so there probably is more investment in objectives 2 and 3. But as I said, we can provide additional detail to the record.
And Dr. Boothby, we'll have more testimony on the second panel, which we're going to move to in just a minute. But why don't you just mention sort of and restate again, the latest findings about attachment, that it's attachment to a 1 or 2 particular adults, not attachment to multiple adults, and the difference between that as we're trying to build some of these programs. I mean, what is the difference in your mind between a child's attachment to 1 caring adult or 20 caring adults?
Well, again, I think that Dr. Nelson will probably speak to this, so I'll be brief. But essentially, the last trimester of pregnancy and the first couple years of life, first 24 months, is a critical time in terms of cognitive development, brain development. And we think about nature and nurture, is it this or that? It's both. It's a combination. As children's brains are growing, the experiences that they receive or the experiences that they're deprived of become part of their DNA. It actually gets in. It's what the epigenetic signature is in a sense. And if you don't get that stuff early, and I think this is what the Bucharest study shows us, it wasn't that the orphanage couldn't feed children. It wasn't that they weren't getting health care. It's they were getting inadequate social stimulation. And the only constellation of human relationships that we've found in the world that does this on a regular basis is the family. And it can be extended, it can be nuclear, but at heart, whether it's an aunt, an uncle, a grandmother or mother or father, having that person in a child's life that when she cries, she's held. When her diapers or the equivalent thereof are wet, she's changed. When she's hungry, she's fed. That becomes part of who we are, and we are wired for human connections. And it's an area that we need to pay much more attention to.
Thank you. Dr. Bissell, let me ask, UNICEF is recognized as a world leader ensuring the survival and development of every child. Last year, our government, the U.S. government, contributed about $132 million in direct support to UNICEF, as well as millions of other dollars for country-specific grants. Can you tell me what portion of the money that we send from this committee to UNICEF was dedicated to programs specifically promoting permanent family care for children? Any idea?
UNICEF's child protection work, broadly, it receives 10% of UNICEF's overall funding. So the allocation that you described goes into what are called regular resources, which then get dispersed through
But
all
child
of the UNICEF
protection
programs.
work is much broader than children and families, right?
Right,
So it would be less than 10%?
absolutely less than 10%.
What portion of the 10% do you think it would be dedicated to finding permanent families for children?
I wouldn't have that data.
Okay, if you could try to get us that data, I think it would be important. Do you know what portion of UNICEF funding is dedicated to preventing abandonment?
The way the budgets are determined, it would be under a broad category of child protection programming, which is, as you probably know, the budgets are done on a country-by-country basis, so it would be possible to aggregate the programs that are specifically dedicated to the system strengthening work and aspects of interaction with families.
Okay, so you're testifying, which is a little concerning to me, and I think would be concerning to other members, but it is what it is, and I appreciate you being so clear that there is really no way to track how much money of UNICEF's budget is either going to preventing abandonment, going to reunification of family care, or going to find domestic adoptive families or kinship adoption or inter-country adoption.
Well, first, I'm not testifying, I'm briefing, so just for the record. And I am saying that it is possible to disaggregate our budgets to determine which parts of our child protection program, for instance, are addressing child soldiers or humanitarian, and those that are addressing child protection system strengthening, which would speak to your point.
Well, I'm going to ask for UNICEF to provide some detail to this committee because I think it's important for the committee to look at it through the lens of how UNICEF's budget is either supporting or currently organized to support this Children in Adversity plan based on the 3 goals. So to look at your budget under a new light, which is how much is helping kids survive and thrive in the early years, how much of the UNICEF budget is going to find permanent families for kids, how much of the UNICEF budget is primarily for protection. And it might be a good exercise for UNICEF to be able to go through the budget and provide some detail on that. One of the most critical needs facing world's vulnerable children is the lack of surveillance and baseline data. I think you testified to this. Would you say that it's, of all the groups and organizations in the world, and I think UNICEF has the most money to spend of any child advocacy group in the world, is that true? UNICEF has the most money. Is your budget, what is it, $5 billion?
The budget is a little less than $4 billion annually, all privately raised, but I haven't actually seen data that compares us to other organizations.
Do you think, does anybody at the table know of any organization larger? Do you, Dr. Ryan? Do you, Dr. Steinberg? Do you, Dr. Boothby? Okay. I think that UNICEF is the largest. If I'm wrong, then somebody can correct me. So given that you're the largest group in the world focused on children and you're producing the State of the World's Children Report and other sources of data, what advice would you give to the U.S. government as it attempts to build a system to measure the effectiveness of programming for children in adversity? That's question number 1. And 2, do you believe that UNICEF's data gathering approach through household surveys adequately captures the full spectrum of children in diversity? If so, why? And if not, why not?
I think your second question speaks well to the first, and it's not a surprise. The whole area of measuring out-of-household populations I think has been, well, the evidence would suggest has been grossly overlooked. So we've invested as an international community in DHS, demographic and health surveys, and in multiple indicator cluster surveys, which look at households. And those are a good way of tracking what happens in households. And your second question, you know, if you're going to track the National Action Plan on Children in Adversity, and as Dr. Boothby has already indicated, a priority area of data collection on out-of-household populations is precisely the way to go, and something we've also been advocating for.
Okay, so you are sharing information before this committee that indicates, I just want to get this straight, that currently UNICEF, which we believe is the largest group in the world focused on children's health and well-being, is not counting children out of households? Yes or no, or?
Well, we are, but there's no comparable method to DHS and mix for out-of-household populations. There are many approaches, in many different countries for determining, for example, we're currently surveying around the world the number of children in institutions. There's actually no global number on that. Governments need to put systems in place to collect that kind of information. We're supporting that, but there is no universal, systematic approach to collecting data on children out of households.
Okay, so out of households would mean children in orphanages or institutions or group homes, children's homes, licensed, unlicensed. It would also mean children in refugee camps.
In refugee camps, on
It would
the
also
streets,
mean children on the streets.
in brothels, yes.
Yes, in brothels, in drug trafficking, in the sex trade, all of the above. We don't have a real accurate count. So how do we actually know how many double orphans there are in the world if we're not counting accurately?
Well, the double orphan issue is I mean, our information on household, the information that that is used for determining that is actually quite, I'd let Caroline comment, but there's actually a systematic method of data collection in terms of children affected by HIV and AIDS. But I think we know that we have the single and double orphan definition gets us into a lot of trouble.
Well, let's describe what those definitions are real quickly before we move to the second panel, because I think it's important. What is a double orphan? What is the definition of a double orphan?
A child who has neither father nor mother.
Okay, and what is a single orphan?
A child who has lost one parent.
Okay, is there a word for a child that has lost either one or both parents, but that is currently unparented because the one parent they have is not willing to parent?
No.
Do you know a title for that? Okay, so we don't even have a definition of unparented, really. We just have double orphans, we have single orphans, but we don't really even count kids that have a single parent, but a parent that is either unwilling or unable, like if a parent was a paraplegic and couldn't, or if a parent was in jail for the next 30 years and couldn't, or a parent that was missing, alive but missing. We don't have good counts of that.
No.
Okay, Caroline, do you want to add anything, Dr. Ryan, to this discussion?
Just to say that often what we see is if a child, even if it's a double orphan, it is sometimes cared for or often cared for by an extended family. So it's brought into a family unit. So we often find our support going to households where there are orphans, but the household is supported. It may be a grandmother or an aunt, especially in sub-Saharan Africa. So I wouldn't say that it's necessarily the same thing as a child that's been abandoned to the streets. But those are the households that we're supporting because of the extra burden, usually an economic burden, to try to keep those, extended family households still viable.
Right. Do we have any actual data of how many single or double orphans who are unparented have been placed with family members? And do we have any information about how those children are thriving in those extended families?
We could probably get that information if we were to go to the country level and look at what the household programs are doing. They probably keep track of who's in the households and what kind of support.
Would you do something, would you just pick one country, the best country that you think is doing that work, and submit some data to this committee within the next 30 days about their reports on children who are unparented, who have been taken in a guardianship or an adoption by the extended family, and what their reports are regarding the status of that child
We'd be happy to do that.
and the programs that support that.
Okay.
Okay, the record will be open, for other members as well, for other questions to be submitted to the record. Let me just ask each of you to give a 30-second wrap-up, something that you want to say that you didn't say that you think is important, starting with you. Dr. Steinberg.
Well, just addressing your last question, that is one of the purposes for identifying 6 countries over the next 5 years for intensive activity. And we have a variety of metrics we're applying to decide what those countries are, including how best to impact the most